So as I alluded to, we have Laís Pereira presenting today. We got to know Laís as she visited Durham and Duke University as part of the Cappy's Sandwich Doctorate Program, if I'm not mistaken. And she's going to present something that's a little bit different than some of the things that we're used to, about one of our most common topics, which is alcohol use disorder, but looking at it in a really interesting clinical way. So without getting any more wrong, I will turn it over to Laís. You should be able to share your screen now and go ahead.
Thank you, Ashley. Can you see screen?
Yep.
Yeah.
Okay. So thank you, Ashley, for the brief introduction. Sorry about my English. Maybe it's a little bit rusty because it's a long time that I don't speak in English. So the paper, it's all the analysis was done when I was at the Gemini last year with João Ricardo guidance and Nata helps, Nata Nascimento. The data was acquired while I was in my PhD here in Brazil. And the paper was published last January. It's one of the two papers that we published. And this one is about reduced gray matter volume in limbic and cortical areas is associated with anxiety and depression in alcohol use disorder patients. It's a short presentation because I think in here the most important is the result and the statistical approach that we did. But just to make a brief introduction, that individuals with alcohol use disorder has cognitive impairment, emotional problems, and behavior change. Let me put in here. Yes. And behavior changes. And all this is related to the neurological impairment, like reduced brain volume and brain cognitive disruption. So all these neurological impairment can result in a behavior change that result in a more alcohol consumption. So about this, okay, our hypothesis is that lower gray matter volume directly impacts alcohol severity while also exerting an indirect influence through the effect on cognition, anxiety, and depression. So our aim was to describe the relationship between brain volume, behavior, and alcohol severity using a theoretical RDoC-based exploratory structural equation model, the ESEM model. So for this, we have two groups. One group with male patients with alcohol use disorder. All these patients was in treatment for alcohol addiction, and they have a psychiatry diagnostic for addiction. And we have a major lower risk alcohol use non-dependent individuals that we call them the control group. So for both groups, we applied the alcohol smoking and substance involvement screen test, the ASSIST. So we applied this test because the alcohol group was in a hospital for treatment, and this hospital make treatment for a lot of different substance use, and we want to make sure that we was selecting just patients with alcohol consumption. And we apply in our control group just to exclude some individuals that use some kind of substance in an addiction way. So we also applied the self-reported questionnaire for anxiety and depression. We used two cognitive tests. One of them was for memory test, and the other one was for decision-making test. And for all individuals, we acquired the morphological magnetic resonance images. So the first step was to select the RDoc construct that we was using in our ESEM model. So we select 4 construct and subconstruct that we allocated our cognitive and emotional testing in each of these constructs. And then we select a specific brain area that is responsible for the cognition and emotional control. So we select specifically the ventromedial and orbitofrontal cortex, amygdala, ventromedial and dorsal hippocampus, posterior and anterior cingulate cortex, and the insular cortex. We know that the brain it's all connected, so we cannot exclude the effect of the other regions in this control of the cognition and emotional, but we select specific areas related to this control. So this is the reason that we selected this area that is responsible for decision-making, memory, and sight and depression that is allocated in each of these constructs of the RDoc. And then we make a ESEM hypothesized model that wants to test the reduced volume of each of these regions, directly influencing the alcohol severity, but also indirectly influence the cognition, the anxiety and depression that can be influenced the alcohol severity. So the first step was to acquire the brain volume for each of that specific areas for all the individuals. So in this image, we can see the mask that we created to extract the volume of the brain regions. And when we did this, we saw that the individuals in the alcohol group has a lower brain matter volume compared with our control group. We also saw that the alcohol group has a higher assist score, has highest depression and anxiety scores, and lower memory and decision make scores when we compare it with our control group. All these results we already was expected because the literature has been showing all this clearly. But after we extract the volume of the brain of these regions and get the scores for depression, anxiety, memory, and decision making, we put all these in a ESEM theoretical model. So the first step was to create a confirmatory factorial analysis. When we did this, we created 4 latent variables. So 2 latent variables relate to behavior. So we created 1 cognition latent variable that we put together our cognition tests. We created 1 emotional latent variable that we put together our emotional tests, and 2 latent core brain variables that we put together the cortical regions, like a cortical variable, and emotional areas that we put together. So we created 4 latent variables. And we use in our ESEM model the education level because the control group has higher education level than the alcohol group, but it's a significant difference. But I want to make sure that all individuals has a high education. So all individuals has completed the high school and the graduation, but the control group has more years of studying, so they have a post-graduation. So when we put the education level, we expect that when you have lower education level, you have a more alcohol consumption. And if you have the higher education level, you have a lower alcohol consumption. And like we was expecting, that education level influence our cognition variable. So if you have a higher education level, we have a better scores in the memory and decision making. When you saw the relationship between the cortical latent variable with cognition, we also saw that if you have a higher brain volume of these regions, you have a better performance on memory and cognition. We know that we cannot make brain grow, so you can interpret it in the opposite. So if you have a lower volume of these cortical regions, you have a lower cognition performance. But we didn't see a relationship between cognition and the assist score. And neither the cortical areas influence the assist score. So we can see that the cortical areas is negative, but is not significant. So when you saw the emotional latent variable, we saw that if you have a more depression inside, you have a more higher assist score. And then if you have a lower volume of limbic regions, you have a higher depression and anxiety. But the limbic areas didn't influence directly the assist score. So what we can conclude when we did this ESEM model at that the limbic areas influenced the anxiety and depression scores, that directly influence the alcohol use. So despite the limbic area didn't influence directly the assist score, you can see that the limbic areas indirectly influence the assist score because they influence the emotional scores. It's a little bit confusing, but I think the colors, it's helped. So based in this ESEM model, we could conclude that despite the difference in memory and cortical brain regions between the alcohol and control groups, our ESEM model revealed a more significant involvement of limbic regions in alcohol use severity, demonstrating a strong association between alcohol and mood disorders. So we have some limitations. I selected the three of the most, for me, important limitations. That is, the lower brain volume may have been the result of the neurodevelopment impairments because of the biological and environmental factors that predispose to alcohol use, or the lower brain volume can be the result of the alcohol use. So this is a limitation that we cannot answer, because for this we needed to start to make a resonance magnetic acquisition before they start to use the alcohol. So we only included male patients, so we be careful when we can use these results in a female gender. And we have a limited sample size. We have just 100 patients in 50 in each group. So this is a limitation because we had different variables that can influence our model, but we cannot put, because if you put the same model, doesn't sustain it. So I think this is the most three important limitations. And I know that it's a little different that the Gemini used to do, but thank you for your attention. And I think that's it.
Awesome. Thanks so much, Laís. If anyone has some questions or comments, please feel free to share in the chat. I've dropped the link to the paper there, or you can unmute and let us know your thoughts. Great work.
Yeah, Laís, amazing work. I think it's really important to start to understand this link between substance use disorder, anxiety, and depression, because it turns into a clinical sort of catch-22, right? What comes first, and how do you treat same time. Some questions I have for you, but one that I'm going to focus on, and I'd love to hear the feedback that you have for it. The choice to include only males or men uh, in the study itself. What was the foundation for that? And then how do you believe that that is going to impact your data and your results? Specifically thinking about um, premenopausal, menopausal, and postmenopausal women in terms of the estrogen differences. We get a lot of different um, um, anatomical differences, right? And so, like, how do you propose to then now also think about women in this situation?
Uh, Thank you for the question. It's everybody's asking me these questions because in the first time when we submitted the idea, we put both gender, female and male. But was when I started my PhD in 2017. Yes. But the hospital that we have all the acquisition that we had all the acquisition, the female that go to treatment, it's 1 for 10 male. So we have 1 woman to 10 male. So, and the woman never wanted to participate of the study. We didn't discover why they don't want to participate, but was like really hard to acquire woman. And then started the pandemic situation, and I had to stop all my acquisition of the patients. And then when we returned, it was like 1 woman go to treatment in each month. So it was really difficult to get access to the woman. So we decided to, okay, let's just focus in male because the time is passing and I have time to finish my PhD. So, okay, let's finish it with just male and then maybe start again in another opportunity with woman. And about the questions about the hormonal influences, I think in woman could be a really different results because we know that the hormones make a lot of neuroplastic changes in the brain. In each period, you have a modulation in the brain. So I think all this can be different in women. So this is the reason that we be really care to put these results in a female sample.
So,
But just to conclude it, we have like 100 male patients and like 5 women in the study.
yeah, awesome. Yeah, I can't even imagine how difficult it would be, especially having so few women in your sample. So really nicely done. And I obviously haven't read the full paper, but I really hope that you focused on the fact that this is a very male-dominated population because there are benefits for that, right? And this is very applicable to the male population. And then we just have to think about how to do this in women because you would need multiple ages and multiple sites to be able to collect women. So really, really interesting.
Thank you. Thank you so much.
Some nice compliments in the chat. Any other questions or comments for Laís?
I have more unless you guys have any questions. Laís, what do you want to do with this next? Where does this go next?
Okay, so we have a lot of different data that we acquired together with this. We have functional magnetic resonance. We have the genetic information of these individuals. We have the serologic data. So now we start to do a genetic analysis to see how the genetic changes when you are using alcohol. So, but we start to propose the idea to see more directly to the neurodevelopment to see how the traumatic problems that you have during your childhood can influence the results when you are adult. So we start a project like just a proposal that we want to see how the traumatic that you have in your childhood influencing your brain morphology and your genetic when you're an alcohol patient. So, but we first wanted to finish all our data that we already acquired. We've finished the paper with genetic and functional, and then start this with depression and traumatic problems when you have in a childhood.
Awesome. Sounds really exciting. Great job, Laís, and very nice presentation. Very well explained.
Thank you. Thank you so much.
Last time for questions. Please share if you're thinking of them. All right. Well, if not, let's thank Laís again for great work, great presentation. Congratulations on the publication. Good job.